All right, thank you. Well, let's get started. I know several of you, and I don't think anyone does a better presentation than Jerry Reinhardt, but I know some of you had to, probably after that presentation, John, you had to go get some Tagamet or Zantac or something just to kind of make your way through all of that. We're going to offer, hopefully, a little bit of a different perspective. I know some of the things may be somewhat of a repeat, but at the same time, I think we'll talk about some of the political ramifications and maybe just a little philosophical information too as to where we think all of this is going. So Jerry, I'm not going to give you the pleasure. Just know that you've done a great job and we welcome you back to the panel. Jerry Reinhardt. Our next panelist is not a stranger to our association. He works very closely with me all of my years of association with the independent insurance agents. I will tell you, and this is not to slight anyone else on staff, but he has always been my constant support and my constant avenue of resource for information. And I can't put enough value to Wes Bissett. Wes is Senior Counsel for Government Affairs for IIANC. He develops legislation, provides technical expertise, offers political assistance to efforts like we're involved with today. Wes is president of the Belmore Group, which is a public policy consulting governmental relations group. Prior to establishing the Belmore Group, Wes worked for our National Association as the Senior Vice President of Governmental Affairs and State Relations. He's served as a congressional aide as well. And you will be happy to know he's not too far from his alma mater. He is an honor graduate of Wake Forest University and then got his law degree at the George Washington University Law School there in D.C. Make welcome Wes Bissett. And then also another, I think, no stranger to you. We have a relationship with CAI, Capital Associated Industries, but their president and CEO, Bruce Clark, is with us again today. Bruce is, as I said, president and CEO of CAI. They're a Raleigh and Greensboro-based employers association. They're dedicated to helping over 1,000 member company associations, and they're very involved with, we offer a product that's free to our membership called InsurExpo. This is where that particular service comes from, Bruce and his group. I know many of you have used that particular service. You may have also read some of Bruce's columns. They appear bi-weekly on HR and management issues for the Raleigh News and Observer, the Greensboro News and Record, and other publications. He is a graduate of the UNC Chapel Hill with degrees in business and law and has practiced labor and employment law. Make, again, welcome to our association, Mr. Bruce Clark. And then our other panelist who was supposed to be here today, David Contorno, recently went through some surgery and was not able to make it today. And it was kind of a day-by-day situation with David, and so he is not feeling well today, so we'll have to remember him, and we will miss his presence there. But I think we'll continue and get with this austere group here. Again, it's not a sexy subject, but I think it's something that all of our agents out here, members of our association, really want to know a lot about, continue to understand the ramifications of the Affordable Care Act. At times I will call it, and this is not a political statement, but please know sometimes I will call it Obamacare. That's what it's kind of known as. That's not a slight to our president. I honor the office and the person there, but sometimes just for, it may come out as Obamacare instead of Affordable Care Act, so please understand that. So it's survived 2 near-death experiences, the Supreme Court and then the president being reelected. It's not going to be repealed. I don't think it's even going to be gutted. So it's something that we're dealing with. More Americans will probably come to accept it now that it's here, now that it's passed. If it doesn't work the way it's supposed to, I think the president's legacy will hang on this issue. If it doesn't work, I think the Republicans will probably say, "We told you so," for many years to come. The big pieces, Jerry, you talked about those, the coverage of pre-existing conditions, the hated individual mandate. They won't kick in, of course, until 2014. But so far, Americans have only seen what I would call the warm-up acts, the letting young adults stay on the parents' plans. But some of those things aren't really central to the law, Wes. So here's what's supposed to happen in 2014, folks. I mean, everybody's going to be able to get health insurance, even if they have pre-existing conditions. Most people will have to be insured unless they really can't afford it. Subsidies will help people pay for some of these coverages. Every state will have a health exchange. We've talked about that, run by the state or run by the feds or run by both. Medicaid will expand to carry or to cover more lower income people. So here's the question, panelists. All that said, here's your time to really pontificate and maybe give some philosophical views where you see it. So what are the odds that everything will go according to plan? Jerry, I'll start with you.
A lot of moving parts, as we've discussed this morning, and a lot of areas I didn't touch on. You talk to the medical community, you talk to hospitals, you talk to officials with the state. As I say, there's a lot of moving parts still not in place. We've already had discussion this morning, some of us, of things that are still being rolled out. The to be determined is still being determined. There's a lot of discussion and things that I read that there's a big struggle going on if the federally facilitated exchange will hit its target date. Because right now, we're to have all the exchanges in place October 1 so that you and I can go there if we want to look at an insurance policy to buy. And I can tell you, I was in Illinois last week, and the insurance carriers right now are working on their rate filings to get them to their states, and so they can have everything ready to roll out with an ACA compliant contract October. Just for a sidelight here, some of you may be wondering what's going to happen if your group policy renews, say, in September, October. What's going to happen? There's two things going on from what I'm hearing with the insurance carriers. One, you're going to get a short rate policy to carry you to December 31st. Then you're going to have an ACA compliant. Probably more carriers in that 3 to 4 month time frame will come out with their ACA compliant, which means much higher premium. So you need to be checking with your carriers to see what they're going to be rolling out. It's going to be a struggle. I can just imagine the heat that the president and Kathleen Sebelius with HHS is putting on all the subcontractors to get everything done, because there's like 110 subcommittees working on every conceivable thing you can, all the technology issues, exchanges, just incredible amount of stuff that I viewed on the internet, and these guys have too. So it's going to be an interesting 6-7 months running up till October the 1st.
Wes, according to plan?
Oh man, you know, if throwing money at a problem determines whether it's going to work or not, then this thing would work. But the reality is there's a lot of moving pieces here. I mean, the federal government is spending literally tens of billions of dollars to put this thing together, both in the state level and the pieces that the federal government controls. There's a lot of complicated issues here. I'll just give you one example. The federal government has to create a data hub, so all the agencies who are involved in this can speak to one another. So you can imagine that includes the IRS. They've even got to check with government agencies to make sure you're not an illegal immigrant. They've got to make sure that you are a legal citizen of the United States. So there's lots of moving pieces that are involved with all this. When I think about it, I kind of like to think of what former Secretary Don Rumsfeld said. You may remember this kind of after the 9/11 attack. He was talking about the problems we had out there, and he kind of broke them down into the three categories. There were the problems we know. There were the issues there were the problems that existed out there, the ones that we knew we did not know, and then the problems that we don't even know that we don't know anything about. So that's kind of where we are. There are certain things they know they have to address. There are certain problems they know that are out there that they've got to ultimately deal with when we know more information. And then there's kind of landmines. They have no idea what those issues are going to be, and those are the ones that are most concerning. When you consider a state like North Carolina, which is like 2/3 of the states, which will have a federal exchange, the feds have put out very precious little guidance today. I think there's something like 19 or 20 pages of regulations on how these federal exchanges are going to work. I mean, we don't even know very much about the role of agents. We know there'll be agents in the exchanges, but we don't know exactly how that's going to operate. So there's a lot of unanswered questions that have to get addressed in pretty quick order. Before I stop, let's talk about timeframes too. This is all going to go live. I mean, people will start signing up on October 1st. So, start backing that up a little bit. By the spring, plans have to decide whether they want to be a party to this. They're going to have to start applying and going through their internal processes. So there's not a lot of wiggle room here. And if I were a betting man, to cut to your question, I think it's more likely than not that there are going to be major problems when this goes live on October 1st.
Any prognostication on Wake Forest ending up with a winning record this year?
Well, Kelly, I was going to say, it's nice to be back in North Carolina. And I don't want to date myself, but I did go to Wake Forest when we did have Division I basketball. Doesn't seem quite that way anymore, but when you lose to Presbyterian and things like that,
that's not on your handout, folks. So don't look for it. Bruce, according to plan.
I sit and listen to this. I agree with what they both said, except I think the question is, what does as planned mean? If as planned, if the plan is to get us to a single payer country, I think this will eventually go as planned, because it's going to cause such chaos and such unintended consequences and such turmoil and such problems with an already semi-broken healthcare delivery system that it's going to get us there sooner rather than later. I don't know the 5 or 10 year thing. I don't know the time frame. But if going as planned means that the real motivation here was to get us to a single payer or Medicare for all kind of system, then I think it will ultimately go as planned. I hear employers say that. I hear employers actually seeking that, wanting that kind of relief. If any of you remember old Jerry Clower as a comedian, anybody old enough to remember Jerry Clower? And he used to have a skit he did, and he'd say, somebody needs to shoot up here amongst us. One of us needs relief. And the employers feel that way. They do not really want to be in the group health business. They don't like it. It's complicated. What other expense item do you have that can rise 30% in a single year? So if as planned means we're going to have so much chaos and turmoil that we're ultimately going to single payer, I think it'll go as planned. If as planned means that this is going to by and large work on kind of an 80-20 basis, kind of 80% of it will, and it's not going to be tremendous unintended consequences, then no, there's a zero chance of that. You're already seeing the unintended consequences. You already see what's happening to your physician. If you live in an urban area, your physician either does now or will soon work for a hospital. That may not be true in the rural areas, but if you live in an urban area, that is what's happening. Why are they doing that? They can earn more money doing that. Why can they earn more money doing that? Because the hospital gets reimbursed at a higher rate because it's a hospital than the doctor can get as a standalone doc. One of the reasons.
One other thing. How many out here have heard the term concierge physician?
Yes.
You're going to see a growing industry of the doctors signing up a bunch of people for $1,000, $1,500. I'll be on call for you. We're getting rid of traditional medicine.
I had my annual physical 2 weeks ago, and my doctor said, by the way, you're going to be getting a letter in about 6 weeks from me. Mm-hmm. Are you interested in concierge? That's what I'm doing.
Yeah. One other little thing. From what I discussed this morning, we in the insurance industry, we understand risk and transfer risk and everything. This is obvious how this was put together really was not insurance. I mean, think about no underwriting. Think about what appears to be no waiting period. This thing that I went through with tobacco. How are we going to find out if you use tobacco or not? All these things that were crafted by non-insurance people that are putting you having to discuss this with your clients. It's a tough situation.
Good point. All right, let's talk about the exchange just a little bit. And Jerry, I know you talked about it in your presentation. The exchange is a portal. It's a marketplace, if you will, online. The feds can completely run it for the state, or the state can do it, or both can do it. This is kind of a political question, Wes, and I'm a little confused by it. But here in North Carolina, I think that from where I see it, right now with our General Assembly in session, I think the train has already left the station, and it looks like North Carolina will probably be a federally complete run exchange. That's a little strange to me in that for the first time since I think it's 1898 that we have a Republican-dominated House, Republican-dominated Senate, and a Republican governor. And most Republicans would espouse to the theory that it's all about states' rights, that no one can do it better than the state. We don't need the feds to get involved with this. So why are Republican-dominated legislatures around the country moving more to opting for complete federal control of the exchange?
You know, Kelly, when this all came about in 2010, I mean, my reaction was the same as you just described. I assumed that most states would say, we don't like this law, but we have the opportunity to take some degree of control over it. So better to have control in Raleigh than to defer and have Washington, D.C. set the 100% of the terms. I think what states have concluded, most states, because you've got 2/3 of the states now are either deferring completely to the federal government or deferring ultimate control to the federal government. Only 1/3 are running their own exchanges. So most of the states have concluded that this is going to be a train wreck, and they don't want to own it. They think when it blows up, better to have sort of our fingerprints not on it at the state level. I also think that there's a feeling that states don't really have discretion on this. That it's suggested that states can establish their own exchanges in the way that they would see fit, but I think that there's a view among state policymakers that that's really not the case. They say, they view it as we've got a little bit of wiggle room within this circle here, but other than that, we can't really dictate the terms of what we would set in a state. So I think there's some substantive, there's a lot of political reasons. I think one of the other challenges was one of timing. A lot of states were hoping, most states maybe were hoping, that the Supreme Court would ultimately step in and throw this thing out. So we didn't get a decision on that until late last year. So it's very difficult if a state did want to pivot and start to establish their own exchange. There wasn't really a tremendous amount of time. I will mention, though, that states do have the opportunity in subsequent years to come back and essentially take control of their exchanges again. So, if there are 2 or 3 years down the road and North Carolina were to conclude, better for us to take ownership of this and to defer completely to the federal government, they'd have the chance to do that. The challenge, though, is that more likely than not, the federal funding that exists today won't be there. Most states that are establishing, or all states that are establishing their own exchanges today, they're building all of this through federal funding. I mean, we're talking billions of dollars in federal fundings going from HHS to the states to put their exchanges together. That funding may not be there down the road if North Carolina ever wanted to come back and reassess where they are. But
so kind of where are your numbers right now? And I know you give to all the execs of the states kind of a running tab. Where are we with states with the total federal control versus a state exchange?
So there are about 17 or 18 states that have said we're going to run completely our own state exchanges. Now they've gotten conditional approval from HHS, which means that HHS said things, states, you look like you're going to be ready for October 1st, but if we conclude between now and some point pretty soon that you're not going to be ready, the feds will step in and take it over. So it's conditional approval in about 1/3 of the states for states to run their own exchanges. Frankly, I think the feds, at least in a couple states, will step in and take that back over. The remaining states are essentially federally run exchanges. So you got the remaining states, 2/3 are all federally run. There's a group, a subset of that, 7 states are so-called partnership states where the feds will have ownership. They're the ultimately responsible party, but states can elect to take on certain consumer assistance or plan management functions in those 7 states. And so that's the deadline to apply for that sort of status was last Friday. So HHS will determine whether those 7, can ultimately reach that status. But in effect, it's really 1/3 versus 2/3, because in the 2/3, I mean, the federal government is the ultimate responsible party. They'll be setting all the rules, and the states that take over maybe some of these partnership functions will have to comply with those. So it's 1/3 versus 2/3, and there's very few. We talk about red versus blue states. There are very few red states within that 17 or 18 state group. There's Nevada, New Mexico.
Mississippi.
Mississippi's
got
not.
Kicked out.
It's going to go federal.
Got kicked out.
They got kicked out. So there's not many red states. Most are blue that have opted to go the state-run route.
Thank you. Bruce, you're here in Raleigh.
Yeah.
Kind of your take on that, why General Assembly seems to be going more to total control of the federal route.
Yeah, I think your instinct's right about the states' rights issue, that would be a typical kind of Southern Republican concept and that they would be strong on it. And I think they are. It's just that we haven't had enough time passed to go from being so anti-healthcare reform and in part winning the legislature in 2010 over the public's angst over healthcare reform to then being able to say, well, now let me flip my mindset here and let's run the exchange. So I think there still is there's that states' rights motivation there, just like you sort of suspected. It's just playing out a little differently. Then I think the other bucket of issues is that, and I imagine many of you can see where they would think this way, that somehow, some way, ultimately, and sooner rather than later, the state's going to get stuck with some of the bill. Don't know how exactly. It's not really, you can't really read that in the law, but there's this visceral feeling that like everything else that comes from the federal government, at some point, they're going to start offloading it on the state. And that is something that's very non-Republican, at least in the fiscal terms. We're going to stay in control of our budget. It's not going to be controlled by the Fed. So I think that's just a couple of add-ons to what Wes said.
Good point.